Good morning. It is Monday, August 23rd. Welcome into the morning medical update. Parents are concerned as COVID cases in children is on the rise. Today, we are so glad to be joined by Dr. Angela Myers from Children's Mercy. She is going to help us with how we can help keep our most vulnerable children safe from Delta and answer all sorts of good questions for us today that I know many of you have. But first, Dr. Dana Hawkinson joins us with the numbers. Good morning. How was your weekend?
Hi. Weekend was good.
Good. All right. Good to see you.
I wasn't in the hospital because of work or COVID, so that is always a good thing. But right now, unfortunately, our numbers in the hospital have increased over the weekend. We have 62 active infections, with 22 in the ICU, 15 of those on a ventilator, so a large proportion. Still 28 in that recovery period, so a total of 90 patients. But obviously, our active infections have gone up. It should be noted we did have 2 inpatient deaths on the 22nd. And overall, in the past week, we've had 9 people that have died here at the health system. So quite a bit. Our numbers of deaths have gone up. Hays has 14 total with 12 active infections and 2 in that recovery period as well.
What does that 9 in the last week and a half mean? I mean, put that into perspective as far as with Delta or maybe what we saw this time back in November.
I mean, we had been going days or a week without deaths, and again, now that we've had 9 in the last 7 days, it is just a consequence of the spread of Delta variant, particularly to those unvaccinated people as well. We should note also that we have 4 vaccinated people of those 62 active infections. So it is just 6% of active infections that we have here in the hospital are fully vaccinated. And again, I think that continues to tell the story. Although our number of vaccinated has been a little bit higher than what we see nationally, the current numbers from the other day and today, again, with just 6% of active infections vaccinated, is consistent with the rest of the United States is seeing as well.
Yeah, we don't like to hear those numbers.
No.
All right, thank you for that update, though. We'll get back with you in just a moment. Do we have any reporter questions on the line today?
Hi, this is Jody Bertino with KCUR.
Hi.
Hi.
Hi. So we've been seeing more and more large gatherings come to Kansas City lately. You know, Planet Comic-Con just took place this weekend. Before that, we had the big Garth Brooks concert. You know, games are back at Arrowhead. How concerned should we be about these large gatherings coming into town? And when, or, you know, really, if will we see the impact of these events on our COVID cases here in Kansas City?
Yeah, I mean, there's a lot of questions in there. You know, how concerned do we have to be? Again, I think it is kind of boiling down now from the medical and the public health standpoint to, you know, you as an individual and what you feel your risks are for an individual, how you can tolerate those risks. You know, obviously, we are not running those. We are not part of the elected officials who determine can these events go on. I just saw another tour that was canceled as well because of COVID. So I think it is boiling down to what is your ability to tolerate any certain amount of risk. And we know it's important because we know the things that can help protect you. Certainly masking, distancing. If some of these events can be outdoors, certainly much safer than doing them indoors. So I think there are things there, and it's really difficult to pin down. Should they be going on, shouldn't they? Because there are so many other factors. But speaking from the pure medical and public health issues, you know, we know, and individually we know how to help reduce risk, and it is doing those things that I've just talked about. How much do we think it will contribute to the surge or increase in cases? It's very difficult to know because we know that people are still going to those other smaller gatherings, not necessarily the big public ones, and still doing that. And we know that the virus can spread in those indoor areas where there's gatherings, either at people's houses, restaurants, any types of those places, you know, well documented, and we understand those things. So it's really difficult to tell how maybe one event will significantly increase the surge. Obviously, we know that risk is there, but doing those things at that event that the individuals can do, such as distancing as much as possible. Hopefully those events are outdoors. Those are certainly safer. Masking, and of course getting vaccinated prior to getting to those events as well.
Other questions today? All right, jump in if you have them, but start sending in your questions. We know you have those for Dr. Myers and Dr. Hawkinson here in just a minute, but I want to turn to our guest, Dr. Angela Myers. She is the Infectious Disease Division Director at Children's Mercy. Thank you so much for being here.
Thank you for having me.
We've been seeing you pop up on television. I know Dr. Hawkinson was saying it was nice to see your face, to come in and kind of have another person in infectious disease help us answer some of these questions. So
Absolutely.
You're doing well?
Yep.
All right. I know you're busy. So I just want to talk a little bit about what type of patient load you are handling at Children's Mercy. Kind of give us a description of what that's looking like.
So we're still seeing increased cases of COVID-19 in the hospital. We had 15 in-house as of this morning and 1 in the ICU. And we're still seeing an increased number of RSV cases. We've consistently had a high level of admissions related to that over the past couple of weeks as well.
All right, so help us understand this. The American Academy of Pediatrics and the Children's Hospital Association said that children accounted for about 15% of the newly reported COVID-19 cases. That was at the start of August, so really before school picked up. So what do you think the cause was then, and what do you think the cause is now? It's safe to assume maybe school back in session, but we really haven't seen those numbers. So
Sure. You know, a lot of things happened. If you look back earlier in the summer months, late spring, we saw a huge decline in cases. People got more comfortable with where we were. We thought we were on the back end of this. People were getting vaccinated very quickly. The vaccine became available for 12 years and above as of the beginning of May. And so we all had a lot of hope and a lot of, excitement around that. And I think what we started to do was kind of let those infection control principles go. We started to hang around each other more without masks in large group gatherings and doing things like that. And at the same time, we had enough of a population of people who weren't vaccinated, right? And kids under 12 can't be vaccinated. And so Delta was able to take hold and really run amok among the community.
You and I just learned that both of our sets of children go to the same school district. What was your thought when the school districts were one by one starting to mandate masks again?
I was so happy when that started to happen. You know, I'm really glad that the school districts made that decision to do mandatory masking from pre-K all the way through 12th grade. There are some that are just doing it for certain grades, but I'm really thankful because this virus is so contagious, and there just aren't enough young kids, again, can't be vaccinated. And even at the high school level, there's so many that aren't vaccinated. In order to best protect everybody, we need to be masked in school. We want to protect the teachers. We want to protect the school staff. We want to protect the kids. We want kids to be in school all day, every day, which is where they should be.
So many good benefits of them being there, but they got to do it right. So do you think, are we starting to trickle in and see, now that school's fully back in session for pretty much all school districts, are we starting to see an uptick in numbers?
I don't think the numbers are upticking related to that. They've stayed fairly steady. 15 is just a few patients lower than what we had last week that were in the hospital, which averaged around 20 a day. We'll just have to see. I know there's some school districts on the Missouri side that still haven't quite started yet. They start this week. And I think it's going to take us a couple weeks to see if we have an uptick in cases related to that. But my hope is not, because if kids are masking in school and they're doing some sort of distancing as best they can, hopefully we won't see that.
Well, hopefully it'll look a whole lot like what it did last year, the schools did it right, and we really didn't see that. So vaccinated or not, if they're masked, goes back to the mask work.
Right.
A couple things. I want to ask you about the vaccine. Any information about when that will be available for those under 12? Do you have any info on that?
I don't know. You know, I have read the same headlines and rumors that everybody else has read, that potentially down to age 5. I've read Labor Day. I've read as early as today. So I think everybody is kind of on pins and needles these next couple of weeks till we hear. I think the hope is high, though, that it will be very, very soon.
All of those dates that you mentioned is very encouraging. That means
very encouraging.
Coming soon.
We are so close. We are so close.
Okay, so I want to bring up a tweet that went out, if the guys can pull that up for me. This was from the physician-in-chief at Children's Hospital in New Orleans. It reads, "Children have become the collateral damage of many adults who frame refusal of masks and vaccine as an issue of personal freedom rather than the common sense of public health measures that they are." Your thoughts on that?
Yeah, you know, I think I think he has a very strong statement here, and I think it's an important one. Kids are always at the mercy of their parents' decisions their whole lives, right, until they grow up and become adults. So, it's our responsibility as parents to make our kids brush their teeth and eat their vegetables and wear a seatbelt and wear a helmet when they ride their bike, just like it's our responsibility to make sure that we keep them healthy by getting ourselves vaccinated and our children who are eligible for vaccine.
Yeah, being the example. Doc Hawk, your thoughts?
I would totally agree. I don't know a lot of parents that would tweet or stand out on the side saying seatbelts hurt and restrain our kids. They do physical and psychological damage. Again, it is really important to be able to understand and trust the people that have so much invested in trying to protect and help and do the best things for kids. And that is American Academy of Pediatrics, our pediatrics colleagues, all these people that are doing all this research. And it is for one goal, and it is to help children, overall and help their health. And by doing that, these recommendations are made, and we know the best way to keep kids in school, because as we had just talked about how important it is for kids to be able to be in school, not have to be quarantined at home and further isolated while doing online learning, whether it's extracurricular activities so you can continue to participate in those. We know that a lot of those extracurricular activities have already started, but competitions will start soon. And so it's very important to be able to allow kids to have that higher chance of continuing to participate rather than being out for COVID quarantine, during this new academic school year, and continuing to do those extracurriculars as well.
Dr. Myers, how is this growing number of hospitalized kids with COVID-19 affecting just pediatric care overall?
Well, so, some people might think that they're completely separate from adult care, but they're not. So when pediatric hospitals get full, then they may not be able to take children from the rural areas, from further away. Those hospitals are also full with adult patients, and it becomes a numbers game. It becomes a game of trying to make sure we have a bed for the person who is sick. And I know that some states have, Texas, Louisiana, Florida, have struggled incredibly finding beds. And I don't think people really understand what that means. That some people go without care, or they wait a prolonged period of time to get care because there aren't beds available. So we really need to see what's happened in other places and do our best mitigation measures here so that we don't find ourselves in that state.
So what's the thinking behind, okay, my kid gets COVID, they survive COVID, but now what when it comes to lifelong long hauler symptoms? That must be a concern of yours.
It sure is. It's certainly not to the degree that it is in adults in terms of how often it occurs, but it does occur. And we do have kids who months after having COVID infection have, chronic kind of lung issues, or have extreme fatigue, or kind of have that fuzziness people talk about, in their cognition or their kind of mental abilities. So, we don't know. We don't fully have an understanding of all of the long-term COVID effects that can happen. And so what we want to do is just prevent the infection in the first place. In addition to long-haul COVID, there's also MIS-C, or multi-system inflammatory syndrome of children. And we don't know which child is going to get that. In fact, children with very mild infections oftentimes will get MIS-C 4 to 6 weeks later. And there's no predicting who that's going to be. And that's scary for parents. Because their child is incredibly acutely inflamed, needing hospital care, oftentimes ICU care, and it can be scary.
What do we know about the deaths of kids under 19? If the ones are vaccinated, not vaccinated, what does the profile of some of these child deaths look like, whether it be here locally or just nationwide?
Yeah, so, by and large, kids are not dying from COVID, although there certainly are deaths from COVID. We've had 450 some odd deaths nationally, and just as a kind of in a comparison, in an average year, there's around 150 deaths in children from influenza. So it's obviously quite a bit higher. But oftentimes it's kids with underlying conditions, but not necessarily. And some underlying conditions that you wouldn't think of would make you at much higher risk for death, such as obesity and diabetes and things like that. So, While it's not nearly the height of adults, it's much higher than it is from influenza, and any death, it really is too many in a child.
You said it. That's a perfect way of putting it, because it is. But I think there is a perception that children are dying now because of Delta than they were before.
Yeah, so let's talk about that for a second. So Delta is more contagious than the previous versions of the virus. If you remember, the Alpha variant that was really prominent in March was more contagious than the original Wuhan strain, and now this Delta is even farther more contagious compared to the Alpha variant. So what we know is that tons more people are getting infected, because for every one person infected, you're going to infect 5 other people, versus I'm going to infect 2 other people, which was what the previous Wuhan strain was. So if you infect 5 other people and they then infect 5 other people, you can see how much faster it grows. When you have far more people getting infected, you're going to have more hospitalizations and you're going to have more deaths. That's just how that works.
All right. Thank you for explaining that, because I feel like parents are asking that, and that's coming up in our questions. So I do want to get to our community questions, but we have a few that came in from Friday that they were really wanting to make sure that we talked to Dr. Myers about. So if I could ask you these. What are the ages of those hospitalized at Children's Mercy? Are they the ones under 12 that are not vaccinated, or is it a mix of both?
It's a mix of both, and it changes from day to day, week to week on which age group is the highest age group. So under 6, sometimes it's the highest, and then sometimes it's the 7 through 11-year-olds. It just depends. Again, even though the vaccine is authorized down to age 12, not all kids who are 12 and older have gotten it. And so by and large, the vast majority of kids have not been vaccinated who are hospitalized. Just like here at KU, very few children are getting hospitalized who've had the vaccine.
Dr. Hawkinson, this time last year, it was about wiping things down. People were wiping groceries down and surfaces down. So Stacy says, how concerned should I be about backpacks and lunch boxes? Do we need to still be wiping all that stuff down before and after school?
Yeah, I think our practices have changed and our knowledge has changed about really what are those high-risk areas about getting and how to get the virus, the infection. And we found that fomites, or inanimate objects such as clothes or book bags or even surface tops, are really not as highly important as being in those areas of poor ventilation, indoor areas, lack of people being masking. That is much more important than the other issues. I think if you can continue to promote good hand hygiene, one thing would be making sure that you reinforce to your children to go to the sink and soap and water after using the restroom, and then when they come home, have them wash their hands, and certainly continue to promote that. But as far as book bags and clothes, I don't think you have to be too overzealous in cleaning those things off. It's really those other things. And just as Dr. Myers had said, if your child is 12 or over, please go get them vaccinated.
Ashley asked, should I send my 4-year-old to preschool if he's possibly going to be the only one masked? Is that safe?
So that's a great question, and it really gets down to your risk tolerance level. So, when I've been asked this by other parents, what I've encouraged them to do is get with their preschool and find out what their policies are. So are all of the teachers and staff at the preschool vaccinated or not? What is their screening policy? How do they know everybody's coming to work that's healthy that given day? And obviously it sounds like this daycare in particular doesn't have a mask policy for all of the kids. I would ask about cohorting. Is just one small class staying together all of the time, or is there mixing? Are they outside most of the time, or are they predominantly indoors? I think all of those kind of factors have to play into your decision making. That's a hard decision to make, and I feel for parents who feel like they are in this rock and a hard place where their child's too young to be vaccinated and they need to work and they really need their child to go to daycare or preschool or whatever, and they're worried that the mitigation measures at that place are not really up to the standards that they'd like them to be.
Yeah, it is a tough decision. Gina wants to know, there seems to be some confusion regarding quarantine. If a child is vaccinated and exposed at school, do they need to quarantine? If a child is fully masked but exposed at school, do they need to quarantine?
Yeah, that goes back to the health department's definition of quarantine. And so each health department has their own definition of when quarantine needs to happen, or what constitutes an exposure. So in some places, if both people are masked, it's not considered an exposure, and so therefore nobody would need the technically exposed person doesn't need to quarantine. Obviously, the person who's positive is home on isolation. But it really depends on your local health department, and so you have to check that out with your school and your health department to know what the policy is on what they constitute as an exposure.
It's hard because we want to go back to what we knew last year, but things are different, and I think people are kind of intertwining the policies from last year with this year, and then it feels like Delta's tougher, but we're not being as tough. It's hard, I think, Dr. Hawkinson, your thoughts?
Yeah, I mean, I think we should add in that the CDC did update its guidance for those that are fully vaccinated. So one more reason to go get vaccinated or to get your child 12 and above vaccinated, because if you are exposed, you don't necessarily have to quarantine. It is recommended to go get tested at 3 to 5 days after that exposure, though.
Question about myocarditis. Did I say that right? It's Monday,
Close.
and I have not had enough coffee. Okay, Cindy wants to know, I read something this week that said myocarditis from the vaccine may not be as severe as it once was thought to be in teens. Can you speak to that? I know many concerned about that for their children.
Yeah, that's a great question. So what it looks like is that myocarditis occurs in about 16 in every 1 million vaccines given. It's predominantly in boys in that older teenage, young adult age range, and typically lasts around 3 to 4 days before resolving on its own. It usually starts with a little bit of chest pain, sometimes prompting a doctor visit or an ER visit, and can be generally treated with nonsteroidal anti-inflammatories like ibuprofen or naproxen, and then again resolves. It is nothing like the myocarditis that is seen with COVID infection.
Are you seeing breakthrough infections, Dr. Hawkinson? You have a comment on that?
Yeah, I would totally agree with that. And there was a good a science update published by CDC looking at a pre-printed article for those of you. It's not peer-reviewed, but they did estimate that risk as well. And the risk of a male getting myocarditis after actual COVID infection is 6 times higher than after getting the vaccine, which can also possibly tend to be more significant illness as well. And if you're a female in those younger ages, it's 21 times higher for getting myocarditis after infection compared to the vaccine. So vaccine continues to be extremely safe in these circumstances.
Holly wants to know, are you seeing breakthrough infections of the children that are vaccinated?
We have seen some, but not a lot, again, because most children aren't vaccinated. So there are breakthrough infections that occur in children, just like that there are breakthrough infections that occur in adults, but it's not nearly the extent of the infections. By and large, the infections are happening in unvaccinated kids.
Okay, so there are a lot of parents who are intertwined with the school district in these school board meetings right now, and so they need a lot of clarification. So Melody says, so many anti-maskers are fighting our school districts, saying the kids' masks have bacteria on them, germs on them that will make kids sick. Could you please comment on this? We'll hear from both of our doctors. Dr. Myers?
Sure. So, okay. So healthcare providers wear masks all day long while they're taking care of patients in the hospital, whether that's in the ER, the ICUs, the general wards, and it is completely safe. There is no concern about a buildup of bacteria that would be harmful to the person. There's no concern about a buildup of carbon dioxide that has been kind of bandied about a little bit, and there's just no concern to your health whatsoever. So we know that it's safe. We do it all of the time in healthcare settings for 12 hours at a time, and so there's really just no science behind those claims.
Dr. Hawkinson, we get this question probably once a week, so it has to continue to be answered.
Yeah. But the people are still out there with their science, too. So I'm not going to say it any better than our pediatric infectious disease expert. But, yeah, again, the consistent evidence continues to be able to support the use of masking because it is safe. There is no evidence supporting those other opinions or theories that it causes more infection, it's harmful for their child. So it's just a lack of understanding what the true evidence and science is, and again, continuing to have your opinions driven by some other narrative. But this is not supported by science. In addition, I would always like to say, and certainly Dr. Myers can correct me, I don't believe that we saw a rash or increase in surges of other types of pneumonias or infections because people wearing masks either in the adult or the pediatric population.
In fact, we didn't. We had an all-time low of pneumonias this past winter because we weren't seeing respiratory viruses over the winter, including influenza.
Susan wants to know, do the children who are being hospitalized have additional risk factors?
So, some do and some don't. So I'd like to make that clear. Some kids do have some underlying risk factors such as obesity or diabetes or immune compromise for some reason, but not all of them. There are plenty of healthy kids who are getting admitted to the hospital. We also have neonates, so newborn babies who are getting it from mom after birth at home or dad or somebody, somebody who's been around the baby, and then are being readmitted to the hospital because they're sick in that first month of life. So it's hitting all ages. It's hitting people who have underlying conditions and those who do not, across the spectrum.
Okay, I have a reporter question. Donna, thank you for sending this in. Okay, so with Pfizer so close to getting FDA approval, possibly today, how soon do you predict companies, restaurants, businesses, and so on to require proof of vaccination?
We are already seeing it. I think that's a great question. I hope that will push some of the more vaccine hesitant people over the edge. But also it will just serve as one more thing, and some other vaccine hesitant groups will come up with another excuse as well. How soon will we see it? I think this will help other companies that haven't done so far be able to mandate that for their employees, and also events or things of that nature that will also probably be one more step towards a lot of these private entities requiring some sort of proof of vaccination as well.
And with FDA approval, do you believe we'll see less vaccine hesitancy and more shots in arms?
That's the hope. That is the hope, whether it's here at the health system, whether it's in the general population, general public. We hope, because that is going to continue to be important. We saw it here today. Last Friday we had 2%, one person who was fully vaccinated in the hospital. Today it's 6%. It continues to be a small number. The vast majority of people that are coming to the hospital are those that are unvaccinated.
Because Dr. Myers, I want to hear what your thoughts are too, because I don't know what the percentages of people that use that as their reasoning to wait for FDA approval. Fair enough. But what are your predictions? What do you think? Is that going to get people off the fence? I know that's what we hope, but do you think that'll happen?
I think it'll help some people get off the fence. I've heard from a number of people who said that they're very willing to get the vaccine as soon as FDA approval comes through, and that's fantastic, and I hope that's true. There are some people who will remain hesitant regardless, and I've heard a lot of people say things like, well, we don't have enough data, or it hasn't been long enough. And I would just like to remind people that we have more data on this vaccine than we have had on any other vaccine in history. So that isn't true. We have more than 350 million doses in our country, billions of doses worldwide. We've got tons of data. We know it's safe and it's effective.
Chad wants to know if you can comment on the boosters. Where are we at? What people should be keeping in mind?
Right now, again, I think you have to look at boosters. What is the reason that we're giving it? For what population? Certainly right now there is only guidance for those immunosuppressed populations, such as solid organ transplant, uncontrolled HIV or untreated HIV, chemotherapy, people who are on other medications to reduce their immune response. So we only have the best data about that, and we are giving those additional doses to those subpopulations. Now, we also saw the Biden administration was going to be pushing for a lot more groups, whether it's certain age groups or people with certain conditions, to be getting additional dosing or booster coming at the end of September. So we're still waiting for all that guidance and data for that. I saw a story in the Washington Post today saying additional dosing reduces infection. Okay, so we also understand how are we judging this vaccine, because right now, for all of you out there who have gotten Johnson & Johnson or the 2 doses of mRNA vaccine, you still have very good protection against that whole spectrum of COVID-19. You still will be significantly protected, even with Delta, from going to the hospital, going to the ICU, and dying. So the vaccines that you have right now are still extremely important and are extremely efficacious at protecting against that. Infection, we aren't looking for protection of infection as much as continuing to protect you from having that illness that makes you come to the hospital, makes you ill enough to go into the ICU, and of course die. So we are still waiting for the full guidance and the data set from that, and we will let you know as soon as we do.
Dr. Hawkinson, Joe from KCTV5 has a question about capacity. How many beds for COVID patients do we have? How many ICU beds available and open for COVID patients right now?
I don't have the exact answers to that because there is, building engineering in play. We have enough beds for what we need, and we have seen even in other surges that we have increased our bed capacity for COVID-19 specifically because we moved into other ICUs. So we are able to do that. We did make all of those, any necessary engineering, airflow types of construction and arrangements and improvements as we needed to. But as we get more COVID patients, over the past 4 weeks, we have increased how many beds we have for COVID by using certain hospital units. And we will continue to do that as needed and as long as we can to try and get everybody that needs treated to be treated.
And do you know how many ICU beds total we have in the hospital? Do you know that info?
I do not know that. Dr. Stites or Dr. Williamson would have a better handle on that.
Okay, well, we can ask that. How's your capacity, Dr. Myers?
Yeah, we still continue to have capacity to care for the children of our region. We have had a number of patients come into the hospital, and luckily children tend to be hospitalized for a shorter period of time than adults do, even with COVID infection, and so we have a little bit faster kind of admission and discharge rate. But we are fine with where we are with our numbers and bed availability for the kids in our region.
How rare is it, or not, for a child to go onto a ventilator or need something, that kind of care? Is that a very rare situation?
It's not the majority of kids who get hospitalized. However, most of the time when people are hospitalized, they require some sort of oxygen. It may be a low amount, or it may be high flow, or it might be in a ventilator. We've had babies in the NICU who needed ventilator support from COVID, and we've had children in the PICU as well. It ranges on any given day. Right now, we've got 1 patient in the ICU.
David just has a thought, and I want to hear what you both have to say. I think many who previously had COVID are not getting the vaccine because they think they're no worse off than those who never had COVID but got the vaccine.
Yeah, so actually this has been looked at, and the data has come out and it's been published, and it's really good data that people who had COVID infection, if they get the vaccine after, have an incredible immune boost response, and it actually protects them very, very well. So I would encourage anybody who had COVID-19 to go ahead and get the vaccine, because we know that that is incredibly protective.
Michelle wants to know your thoughts on schools discouraging parents to cooperate with contact tracers. How do I keep my kids safe? And I'm hearing that contact tracing isn't really being done in many schools this time around. What are you hearing?
Well, so the health department does try to contact trace when there's a positive case, and they work with the school nurse oftentimes to do that. I would encourage all families to work with the school nurse if they ask you questions, and I would encourage you to work with the health department if they also call you. The other thing that I'd like to stress, which is an important piece of contact tracing, is actually getting tested. So I've heard that sometimes parents are not wanting to get their kids tested when they've got mild symptoms, but remember, oftentimes people will have mild symptoms, and it's really important to get that test so that you have your answer and you know if you need to be on home isolation or not.
Dr. Hawkinson, anything to add to that?
No, I totally agree with that.
Okay, so I'm going to read Crystal's question in full because she asks for a recommendation from from you, Dr. Myers. My pediatrician did not recommend my 3-year-old to get vaccinated even when they do approve it for her young age group. She said she hoped they didn't approve it for the younger kids because the older kids were having too many myocarditis cases and that kids do good with the virus. I would like a second opinion as my 13-year-old did perfectly fine with the vaccine.
Yeah. Okay, let's talk about that for a minute. This is really important. So even though most kids do fine with the virus, there are going to be some that don't. And we don't know necessarily who that's going to be, who gets very sick, who develops MIS-C, who develops long-term COVID. This is what we also know. We know that a study that just came out, that even though young kids are not driving this pandemic, right? This pandemic has mostly been driven by adults for the most part over the course of this, since it began. However, data was published last week that showed that if a child gets infected, a young child in the home, they are more likely to transmit infection to their parents, their siblings, close caregivers than the older teenager. This kind of makes sense if you think about it. How much time does your teenager want to spend with you? Not that much. But a toddler, a 2-year-old, a 3-year-old wants to be held and cuddled and read to and all of the things that you do as a parent every single day. So it's super important to get vaccinated to cocoon your young child because they can't be yet. And as soon as it is available for young children, it is actually critically important to get them vaccinated as well. Again, the vaccine does not cause serious issues. We have great safety data, but we know that the virus does. The virus causes myocarditis at a far greater rate than the vaccine does.
I want to ask you to expand a little bit more on myocarditis because several questions keep coming in about that. Michael had a question. Is there any data available on boosters and increased risk of myocarditis? So I just think anything else you can add on to some of our viewers who are joining us about that? That seems to be quite a concern.
Yeah, so the data on boosters is really predominantly in adults that has been published and looking at immune compromised. And most of those adults did not respond to 2 doses of vaccine, which is why the booster study was done, and most people responded to that 3rd dose or that booster dose. So similar to kids, we expect that kids do not respond when they're immune compromised in as great a numbers to the vaccine as kids who are otherwise healthy. And so the 3rd dose is really a 3rd attempt to get them up to a level where they need to be to have immunity. So there's not been myocarditis cases reported in those adult studies. I don't anticipate that to be a big problem with the kids because, again, they're not producing antibody from the first 2 doses, generally speaking.
And speaking of data, Amanda says, but is there data about people getting COVID now who are unvaccinated but had COVID in the past? Of the people getting infected and or getting hospitalized who are unvaccinated, how many of them had previous infection? Dr. Hawkinson?
No, that's a good question, and a question I posed to some of my ID colleagues a couple weeks ago. I don't think we know. I think that's a very good question. What happens if you've had COVID in the past? Especially before the turn of the year, before Alpha became very predominant, before Delta has become predominant. What has happened now if you get reinfected, say with Delta, after having COVID, in January or December of last year? It's hard to know and understand. That's a good question. I don't think we have any data or numbers about that, but certainly are looking for that. Hopefully that is being looked at as well.
And Nancy wants to know what kind of studies are being done on why some people get it when exposed and some don't. We get this question quite a bit. I know a whole family, they were together, most contracted it, one person did and one person did not for some reason. Why is this? It seems kind of random, I think people are thinking it is.
Yeah, that's a great question. So we know that household transmission is not complete. So depending on the study you look at, it ranges from 10% to 27% and is directly dependent upon your exposure to the person who's infected, whether or not they were vaccinated and then got infected. We know that while we know that people who have had the vaccine shed as much virus as those who have not had the vaccine, they shed it for a shorter period of time. So their period of infectivity is likely shorter than it is if you hadn't been vaccinated. So there's a number of factors related to that. And so it's never going to, luckily, it's not 100%. We don't want 100% transmission rate within a family, but it does range dependent upon those factors and then dependent upon how careful you are while you're in the home.
So it's random, but it's good news when not everybody's getting it.
For sure.
Clearly. Anything to add?
Yeah, no, I would agree, with Dr. Meyer's point. In a lot of those household tracing studies, really the average seems to be about 30%. Some have been higher, some have been lower. But even in those household transmission studies, even prior to the vaccination, the attack rate seemed to be about 30% within households as well. So it isn't perfect, but luckily it's not. And hopefully, if everybody can get vaccinated, that does actually help decrease those attack rates in the household as well.
Dr. Hawkinson, Isaac wants to know, and I know so many people want to get back to live events and musics and concerts and all that good stuff, but he says with many live event venues have mandated proof of vaccination, do you think this is really going to help mitigate the spread? What do you think the effects will be long and short term?
I think individually it has helped people to go get vaccinated. Certainly we've seen the stories out there about people trying to forge vaccine cards. They would rather spend all of that time and money trying to get a forged vaccine card rather than just walking into CVS and getting the shot. So I think it's good. Again, certainly anytime private businesses can do that, I think that's reasonable. If they make all those assessments and want to do that, I think that's fine. And I think it just helps to add one more layer of protection, even if it helps just a handful of those people to go get vaccinated. Overall, that will help the cause of helping to stop the spread of coronavirus.
Ashley says, pardon the question, but it's actually a pretty good question. Is it possible to strengthen the doses and only need 1 or 2 as opposed to a third booster? I mean, thinking people maybe don't want to go and get 2, 3 shots. Is there a way to revamp the dosing?
I would say no. So as we just heard Dr. Myers talk about, people who have been infected are still recommended to get the vaccine. Why? Because the vaccine will help boost those current cells that you had already seen, those immune cells that you had seen from that first infection. The same thing with the vaccine. Why are we needing 2 doses for these mRNA vaccines and now sometimes a third? Because number one, it will help boost that immune response, those B cells and T cells. It will also help boost those specific cells that were, maturing during that first dose. And so that overall will help. And so that's why it is important to give that second dose. Even if it's delayed for a month or 2, please go get that second dose of the mRNA vaccine because it will help strengthen or boost those specific immune cell reactions.
Rebecca says, can you discuss Pfizer becoming FDA approved, which could allow docs to prescribe off-label to kids?
Yeah, so, when it becomes FDA approved, the hope is that it will be down to age 5 to begin with, and we can start giving it at that age range. I think that most people are wanting to see the data between that 6 months through 4-year-old, and then even, of course, the 5 through 11-year-old age range as well. My hope is that data is not far behind, and that approval for those age ranges are not far behind as well. But I don't see a lot of people giving it all the way down to 6 months of age without having seen the data first.
Yeah, I'm not sure in this case. A lot of physicians will be doing that off-label. We do prescribe medicines and drugs off-label, but again, typically there is that broad approval for this certain age group or that certain age group. May not be approved for that certain indication, but certainly for that age group. And I think this is a big blocking step to getting it to those younger kids, is that is not approved for that young age, but we are hoping all that data and analysis is coming out soon.
Chelsea, I might just take another question or two, but Chelsea says, can Delta symptoms come and go? Runny nose one day, then you're okay for a day, then you get a headache, that goes away, then you get a sore throat, now you're feeling respiratory, whereas before it felt like you had everything at once, now just symptoms are kind of coming and going, and then how would you know when you should get tested?
I mean, it just feels like the evolution of any really respiratory illness. I think I would go get tested on those first day that symptoms occur, for sure.
Absolutely.
Yeah, and you think that, yeah.
Absolutely agree.
Okay, so some people are feeling, I'm asking Nancy's question because I think there's a little sarcasm, which I agree, but she was like, I hear zoo animals getting the vaccine. Why? Kids now can't. So are these animals in large crowds? Are they going to school, restaurants? What's their lifestyle that they're getting vaccinated, but we can't get our kids vaccinated? People just thinking it's taking a long time.
Yeah, okay, so here's the thing. We have the EUA that came out in December for adults and then all the way down to age 12 at the early of May. And then remember that the Pfizer company submitted for FDA approval right in early May as well. That process for full approval generally takes 6 to 8 months. So right at Labor Day, we'll be at the 4-month mark, which is, initially when people had thought would happen. That's fantastic. It is amazing. It is a major feat for all the people that work for the FDA that sit on the Advisory Committee of Immunization Practices from the CDC to sort through literally a mountain of data to be able to make these decisions. So actually, I applaud them. I am incredibly impressed at how diligent. I think they are probably working around the clock.
Yeah, and I would totally agree. Again, the approval issue in this case was time. It wasn't data. Just as Dr. Meyer said, we have so much data on this vaccine. And I do understand right now there is full approval for the Pfizer vaccine from FDA.
This is breaking news.
Yes.
Okay, there you have it.
This is from CNN.
We need to do a little cheer.
Yes, okay.
So those vaccine hesitant, please go out.
That's what I was going to say. I want you to be reporting the uptick in vaccinations over this next week. So that is really good news. Again, for legitimate people who just wanted to wait for the FDA approval, and that's okay. We've told people if something isn't FDA approved over the years, if somebody gave me a cream, Dr. Myers, and said, here, try this, put it on your face, but it's not FDA approved, I might go, no thanks, So I think that there are some people who just have that stuck in their head and just have to be, have to hear that research. So that is such excellent news. I do have one last question because I think it's a good one. And this is a guy from Florida. He said, a woman from Florida, Terry says, are we, the vaccinated in Florida, getting boosted just naturally by continually being exposed to this virus on its own?
Yeah, you definitely get some boosted immunity from exposure for any respiratory virus, but that's not what we want. What we want to see is that people get vaccinated and we drive the cases down. Just because there are going to be people who don't have any immunity and are going to continue to get infected, which is what's happening now, why we've had this big surge and we've had hospitals be overfull. So yes, you do get boosted from just exposure in the community, but we would prefer that not to be the way that things are going.
Yeah, and again, remember, you have still significant protection. It's not 100%, so you are always rolling the dice with the infection, especially if you have certain comorbidities. But you will get some sort of boost to those B cells and T cells that were created during the vaccination process, and you also may get some specific antibodies toward Delta itself for whatever that may mean and offering protection later on. But overall, yeah, anytime you get infected, you certainly are rolling the dice. So please try to continue to be thoughtful in those things that you're doing, wearing masks, being outdoors if possible, to help reduce your chance of exposure.
And there it is. You just delivered the good breaking news today. Now I'm reading it. So yeah, the Food and Drug Administration on Monday granted full approval of the Pfizer BioNTech COVID-19 vaccine for people ages 16 and older. So very exciting. How does that make you feel?
I'm very excited.
Hearing that.
This is wonderful news.
It makes your job easier, I would imagine, in some ways, and you get to say, see, it's safe. Let's do it.
Let's do this. Let's roll.
All right. We want to hear people tell us, yes, we got that news, and now we went out and got vaccinated. So that is great. I want to get your final thoughts, though, Dr. Myers. Again, we're so glad you're here today. Lots of questions, and please come back and see us. But
absolutely. So, just final thoughts are, it's really important for kids to be in school all day, every day. So please have them masked, follow the guidelines of your school, and do the good screening. Try to distance as much as you can and wash your hands. And now that the vaccine is approved, please, if you haven't done it yet, go out there, get yourself vaccinated, get your kid vaccinated, and we can help stem this tide.
Yeah.
Great news today. Dr. Hawkinson, your final thoughts. You're beaming. You're very excited.
I think we've heard some providers that aren't recommending it or physicians that aren't recommending. I think in those cases where there are physicians not recommending getting dosed with the vaccine either to you or your loved ones or your children, it's probably time to seek other providers. It would just worry me on what other complex issues they are not up to date with the current evidence and what the current evidence supports for keeping you and your family safe. But again, there is full approval now for the Pfizer vaccine. Please, if you're out there on your way to work, coming home from work, maybe you worked a late shift, you've been vaccine hesitant, please go get your vaccine today. We have plenty here at the health system as well. Go ahead and call, get scheduled, and we can get you vaccinated.
Great message. Love it. Thank you so much for being here. I think you're coming back next week, aren't you?
I am.
Awesome. Okay. Love it. All right, everyone, thank you so much for joining us today. Tomorrow, we look at COVID-19 testing. Lab staff are working overtime as more and more people are getting tested. We explain how the test works with the Delta variant, plus are rapid tests reliable? When should you get tested? A lot of questions about testing again. So we're going to break it all down tomorrow morning, starting at 8 o'clock. Make it a great day. We'll see you then.
Subscribe to our Morning Medical Update and Open Mics with Dr. Stites podcasts. Now everywhere podcasts are available.